You might have been dealing with upper abdominal pain for a while, wondering why it keeps happening. It's time to pay attention, as this could be a sign of something more serious, like pancreatic cancer. Let's explore more signs you should be aware of and take seriously. 1. Persistent pain in the upper abdomen that radiates to the back is a classic symptom of pancreatic cancer. This pain occurs because the tumor may press against nearby nerves or organs, creating a deep, gnawing discomfort. It's often described as a dull ache that worsens when you eat, especially fatty foods, or when lying down. Unlike the occasional discomfort from indigestion, this pain doesn't go away and may even increase in intensity over time. If you're experiencing this kind of persistent pain, particularly if it's accompanied by other symptoms like weight loss or jaundice, it's important to see a doctor. 2. Jaundice, characterized by a yellowish tint to the skin and eyes, is often one of the first visible signs of pancreatic cancer, particularly if the cancer is located at the head of the pancreas where it can block the bile duct. This blockage prevents bile, which is responsible for breaking down fats, from flowing into the intestines, leading to an accumulation of bilirubin in the blood. You might also notice dark urine, pale or clay-colored stools, and intense itching due to the buildup of bile salts in the skin. Jaundice can be alarming, but it's important to understand that it's often a sign that something is seriously wrong within the body and should be evaluated promptly. 3. Along with jaundice, one of the more uncomfortable symptoms of pancreatic cancer is intense, widespread itching. This itching occurs due to the accumulation of bile salts in the skin, which happens when the bile duct is blocked by a tumor. The itching can be relentless, often affecting large areas of the body and leading to restless nights and significant discomfort. Over-the-counter anti-itch creams are typically ineffective because the itching is caused by an internal issue. If you're experiencing severe itching, especially if it's accompanied by jaundice or other symptoms of pancreatic cancer, it's important to consult with a healthcare provider. 4. A sudden and significant loss of appetite can be an early indication that something is amiss with your pancreas. As the tumor grows, it can interfere with the digestive process, making you feel full after eating only a small amount. This early satiety, coupled with a general lack of interest in food, can contribute to the unexplained weight loss often seen in pancreatic cancer patients. You might find that foods you once enjoyed are no longer appealing, or that you simply have no desire to eat. This loss of appetite can lead to malnutrition, weakening your immune system and making it harder for your body to fight off the disease. 5. Pancreatic cancer can cause significant changes in your bowel movements. Because the pancreas is crucial for producing digestive enzymes, a tumor in the pancreas can lead to malabsorption of fats, resulting in stools that are pale, greasy, and foul-smelling. These stools, known as steatorrhea, often float in the toilet and are difficult to flush away. You might also experience diarrhea or constipation as the tumor affects the digestive process. Paying attention to these changes is important, as they can be one of the earliest indicators that something is wrong with the pancreas. 6. Pancreatic cancer is associated with an increased risk of developing blood clots, a condition known as thrombophilia. Blood clots, particularly deep vein thrombosis, DVT, can be a serious and potentially life-threatening complication. DVT occurs when a blood clot forms in a deep vein, usually in the legs, causing pain, swelling, and redness. In some cases, the clot can break loose and travel to the lungs, resulting in a pulmonary embolism, which can be fatal. If you notice symptoms of a blood clot, such as sudden pain or swelling in your legs, it's critical to seek immediate medical attention. 7. As the pancreatic tumor enlarges, it can exert pressure on surrounding organs, including the stomach. This pressure can cause a range of digestive symptoms, including nausea and vomiting, especially after meals. In some cases, the vomit may contain undigested food, indicating that the stomach is not emptying properly due to a blockage caused by the tumor. Nausea and vomiting can be persistent and may not respond to over-the-counter remedies, making it difficult to maintain proper nutrition and hydration. If you're experiencing these symptoms regularly, it's important to get them checked out, particularly if they're accompanied by other signs of pancreatic cancer. 8. One of the most alarming and common signs of pancreatic cancer is rapid, unexplained weight loss. This symptom occurs because the cancer can interfere with the pancreas's ability to aid in digestion, leading to a loss of appetite and malabsorption of nutrients. Even if you're eating normally, your body might not be able to extract the necessary nutrients from your food. Over time, this can result in a significant and noticeable drop in weight. If you find that you're losing weight without trying, particularly if combined with other symptoms, it's crucial to seek medical advice. 9. The pancreas plays a vital role in regulating blood sugar levels by producing insulin. Pancreatic cancer can disrupt this function, leading to the sudden onset of diabetes, especially in adults with no previous history or risk factors for the disease. If you've recently been diagnosed with diabetes and are struggling to manage your blood sugar levels despite following your doctor's advice, it could be an early warning sign of pancreatic cancer. This is particularly true if the diabetes comes on suddenly and is accompanied by symptoms like weight loss, abdominal pain, or jaundice. If you're experiencing these symptoms, it's important to discuss them with your healthcare provider. 10. Interestingly, depression and sudden mood changes can sometimes be early signs of pancreatic cancer. The connection between cancer and mood changes is not entirely understood, but it's believed that the cancer may cause chemical changes in the brain. If you've noticed a sudden onset of depression, anxiety, or irritability, especially if these changes don't seem to have a clear cause, it could be related to an underlying health issue like pancreatic cancer. It's important not to ignore these emotional changes, as they might be an early indicator of a serious condition. 11. Chronic fatigue is a common complaint among those with pancreatic cancer. This isn't just the tiredness that comes from a long day, it's an overwhelming sense of exhaustion that doesn't improve with rest. This fatigue can be so severe that it affects your ability to perform daily activities, leaving you feeling weak and drained. The cancer itself, combined with the body's efforts to fight it, can sap your energy reserves, leading to a persistent state of fatigue. Additionally, malnutrition, anemia, and disruptions in sleep caused by pain or discomfort can all contribute to this debilitating tiredness. Catching the signs of pancreatic cancer early is crucial. If any of these symptoms sound familiar, don't ignore them, consult a healthcare professional. Your health is your top priority.